My name is Woodward and I'm a breast surgeon at Luminis Health. I focus on the treatment of all breast disease, including breast cancer, high-risk breast disease, and benign breast disease. I actually didn't always know that I wanted to be a doctor when I was a kid. I knew that I was interested in math and science growing up, but didn't know what I wanted to do with that. And then at the end of high school and the beginning of college, I had the opportunity to become involved with an organization that made trips down to underserved areas of Nicaragua. And through that, I had the opportunity to work very closely with a surgeon and had the opportunity to really see the power of medicine and the impact you can have on people's lives through medicine. And ever since that moment, I've been hooked. I chose to dedicate my life to breast surgery for many reasons, but really the reason I chose breast surgery is for the patients themselves. When a patient comes into my office with a diagnosis of breast cancer, and being able to work with them through their treatment and see them come out on the other side stronger than they were before is one of the most powerful experiences and such a really great opportunity and a pleasure to be a part of. To me, the most important part of the patient-provider relationship is trust. Because when someone comes into my office with a breast cancer diagnosis, it can be one of the most scary and stressful moments of their lives. And so when they come into my office, I want them to, have trust in me and know that they're going to get the best possible care. When a patient comes into my office with a new breast cancer diagnosis, my whole goal of that first visit is to really get to know the patient well, get to know their family well, and really understand their diagnosis, but also their individual wants and needs out of their treatment. And so I'll sit down to get to know them very well, and I want them to get to know me very well. And then I really want them to understand their diagnosis and their treatment options so that we can work together to come up with the best possible treatment for them individually. One of the biggest joys in my life is working with breast cancer patients. Growing up on the Eastern Shore, my parents always taught me that the biggest joy you can have in life is serving and helping others. And having the opportunity to serve and help the women in this community is the biggest pleasure and opportunity that I could ask for.